Good morning, ma'am. I am your student nurse. I am Danmar C. Yepes. This morning, I will be performing the assessment of the breast. So first is, of course, you have to gather all the equipments. So we have the gown, and I have the gloves. Okay, I have, it's optional if it's working gloves or surgical gloves. Alright, so next one is, first of all, you need to identify your client for you to know if that's the right patient for you to be asked. Alright, so first I'm going to perform is the female breast. Alright, so good morning, ma'am. I am your nurse for this morning. Alright, so you need to make sure that the client can be able to participate during the breast examination. And of course, what could be the best positions during the examinations? Either your client is in the sitting position since this is more on assessment. And next one is you need to advise your client to do breast self-examination if she want, alright, when doing the palpation. Okay, so next one is you need to explain the procedure, what is the purpose of the procedure, and then you have to ask the client to put on gown. So assuming that the client is wearing gown, so this time I'm using a improvised picture of the breast because we cannot find an actual one to volunteer for this procedure. Okay, next to perform is first is the female breast. Right? So in the female breast, of course, you need to check. Of course, you have to be mindful of the anatomy of the breast. All right. So first, you have to inspect the breast. Okay. So in this case, okay, having assessing my client, of course, you have to check the size and the symmetry, the color and the textures, the superficial venous patterns, retractions, and bilaterally note size, color, shapes, and bilaterally note size and directions of the. In this case, as you can see, if you're going to check the size, right? So it seems that they are in good shape. They are in the same shape. Okay, fair color. The nipples, as you can see, is in it's not an inverted, right? So there's no any lesions, there's no any retractions, dimpling, alright? So there's no any problem, alright? So next is you're going to palpate the breast, alright? So in palpating the breast, assuming that I am wearing gloves, okay, if the patient having a breast self-examination, you need to explain it to the client that when doing the breast self-examination, it's okay to have at least once in a month. If there's any abnormalities, right? Then it should be right after or in the 4th or the 7th days after your menstruations, because we don't know if there's any hormonal changes that will happen. Then it will be mistakenly what do you call this? It will be mistakenly diagnose you if there's any lumps or masses if you're going to do it during the menstruation. So you have to advise to your client. Of course, in palpating the breast, it's very important to check the elasticity and the tenderness. Okay, ma'am, let's palpate, ma'am. Alright, do you feel any pain? So in this case, the patient has no any complaint, has no any abnormalities, no any masses. Okay, when checking the locations, alright, so the consistency and there's no any tenderness. Okay, by checking the nipple, there's no any signs of redness or swelling. Okay? So when the client can be able to move herself, there's no any pain or there's no any tenderness. Alright, so of course, if the patient have gone or mastectomy, right? So you need to observe if there's any scar, right? So that's it. Next one to perform is, right? So this one, my client, my female client, has no any abnormalities or unusualities during the assessment of the breast from the assessment during the inspection to palpation. So abnormalities, ask your client to be referred to the, what you call this, to the physician. So in this case, the patient has a normal findings. Alright, thank you so much, ma'am. Okay, if you have any questions, you may actually ask about what could be the proper procedure of the breast self-examination and what could be the proper stroke in doing the breast self-examination. Right? The next one to perform the male breast. Alright? I'm still using a picture of the male breast. Alright? No difference about checking the male breast. Only just to check, same of course, the color, okay, the consistency, the elasticity, right? If there's any signs of lesions, if there's any signs of masses or lumps, because it would be possibly that the male can have, or actually can have, that kind of condition. Same with the woman, and that's it. So by looking out of this assessment, right, of the male and the female, so the patient has no any abnormalities, has no any abnormal findings. Alright, so in this case, you need to ask the client, right, if there's any abnormalities. Okay, you have to come back. Okay, so that's it for the assessment of the female breast and the male breast. Right, so and then after this, okay, so you have to ask your client, ma'am, thank you so much, sir, thank you so much for your cooperation. Right, so for the female, okay, advise the client as necessary once a month for the breast self-examination. Advise the client, okay, the proper time, okay, the proper places, okay, in order to check, okay, if there's any lumps or masses, okay. And for the male, no, it's not necessary as indicated, as needed, for the breast self-examination, right? So in this case, my patient has a normal findings. There's no any referrals, right? So after that, so I have to ask the client, "Ma'am, thank you so much," and advise the client to wait for the remarks or any instructions, and then, assuming that I have remove my gloves, do hand washing, follow the hospital infection control or policy. Excuse me. And then you have to make a formulate and make further make referrals for further management. So that's it for the assessment of the breast of the female and the male. Thank you so much.